Good morning. I'm going to take you through my morning routine, my morning stretch routine. I had years of back pain and I had severe pain. I could only stand about 10 minutes. It would spasm, it would snap, I would fall to the ground. And so I developed a program over the years that helped me to relieve my pain. One of the big things I found through studying and the newest literature on pain is that if you focus on just where you have pain, you're probably not solving the problem. You've got to focus on the entire chain, including your upper back, your hips, even down to your feet. So I'm going to show you this morning routine that I have, and we're going to go through it. A couple things that I always start with in my day. So I always start with a glass of water. So critical that you have first thing in the morning a glass of water to help hydrate your body, your cells, get you going right. The other thing I do is I always make sure that I drink my Energize, and this is a peptide drink that it works with your cells to increase energy, to improve cellular function, and to give you sustained energy throughout the day. That's the key. I don't get afternoon lulls anymore with this. It starts my day off right. Lastly, I have my Fit. This reduces inflammation, especially post-exercise inflammation, helps regulate your metabolism, helps you better utilize your sugars that you've eaten throughout the day. So it's these two things I start every morning with, along with my glass of water first thing in the morning. So super critical that you start with those. Let's get into the program. First thing I do this with my morning meditation, prayer, and study. I sit in this position cross-legged. Now, if you need to and your legs are up here, start here. That's fine. And just gently work on pushing those knees out. So you're going to start and you're going to start leaning forward. You're just going to do a little wiggle into it. Now, they have found that sustained holds are not quite as effective as doing this wiggle into your stretch. So I wiggle into it. I go in as far as I feel like I can. I come out halfway. In as far as I can, halfway, and I just keep working down. Now I'm maintaining good posture this entire time, making sure that my posture stays where it needs to be. Okay, after about 10 or 15 of those, then we're going to switch into one leg in, one leg out. Okay, super critical. Same kind of thing. Now this time, we are actually going to be leaning towards our knee that's in. Okay, and we want to kind of take our neck and our spine, and you want to feel that spine gap and open up. Now again, if you can't get there, if you're way over here, use your hands to help you and just start working into the range of motion that you have available. I'm a little bit further. I've worked on this a long time. I'm working on my posture during the whole thing, and I'm leaning. I'm trying to stay up nice and tall, leaning over, get my whole spine, my neck, my upper back, my low back, all leaning over my hips. Now this is a huge stretch for your hips. Your hips are absolutely critical for low back pain. If your hips cannot get into this position, there's a good chance they're contributing to your low back pain. So we're getting into the stretch, again, doing what you can. If you need to use your arm to help you, great. We're doing about 15 of those, and then we are switching over to the other side. Same position, leg in, leg out, and we are working into it. When I start this in the morning, it's usually a little bit tight and stiff, and I just work through it. Just work through it, and you open up that spine and kind of jiggle in as far as I can, halfway out, jiggle in as far as I can, and just do this little jiggle wiggle in and out, working that spine, again, maintaining posture as we go along. Okay? This is going to be fantastic. Sometimes I will just sit like this on the ground, just give that sustained hold and get comfortable in this position. Okay, after we've done that, then we're going to lay down on our tummy. Now, in this position here, we are going to work on our actual mid back, and we'll work to our low back. Typically, we think of this as like a cobra. We're going to start with our hands way out in front of us. We're just going to gently push back. It's such a small movement initially, and you're working your mid back. We're just trying to work that middle back, and you want to think rolling like dominoes. Roll up, roll down, roll up, roll down. Imagine each segment of your spine rolling up and rolling down. After a little bit of that, now I've got this roll through my mid-back, a little bit further, slide my hands a little bit closer to me, and just keep rolling that. You do not have to extend your arms, okay? You don't have to do that. You just roll through your spine. This is gonna be good for muscles, posture, mobility in the spine, and then you can just kind of work through what your back is comfortable doing. And eventually you want to get through the whole spine rolling, but not overdoing it, and just pushing through gently. Okay, this one you'll do about 20 of them. All right, then we've worked on the 5 movements of the spine and the hips. We're going to jump to rotation. Now the 5 movements of the spine are flexion, extension, forward, backward, side bending, rotation, and then pulling apart. Okay, now this one we're going to bring our feet up. If this is too difficult with your feet up, just leave them down. Do the same thing. Arms are out for support, legs up. You're going to rotate your head the opposite direction of your legs. So as my legs go to the right, my head goes to the left. This is like wringing out the spine. I let the legs drop, turn my head the opposite direction. This is so good for your core. You'll gain incredible strength through diagonals, which diagonals is how we functionally move. And this will also wring out and rotate that spine so nicely. The idea is you can keep your shoulders on the ground comfortably, and your knees can also reach the ground. That's the goal. Now, if you're not there, that's okay. You just work on whatever range is available. And you go through this process, okay? Working through. I've worked on this a long time. I can easily get those knees down. This is one of the most relaxing and relieving movements. Now, if it's not for you, that's okay. You can do the exercises that you need to, and if something is really painful and you can't do it, either do less or stop. Do the ones that you can do until you are able to get to that one, until your body allows it. Sometimes have to free up the other joints before you get to that one. Okay, now we need to do a rotation of the thoracic, and we're going to do that in standing, and I'll show you a modification to this. You get in warrior pose, foot forward, foot turned out. You're going to reach down and grab your inner leg, grab your chest, pull out, and rotate back as you reach back. You're looking back at your hand, okay? And then I just wiggle into that. Now, if for some reason you can't do that, you can sit down, grab your inner leg, and do the same motion. Okay, and rotate. This one's nice because you can do it in your office chair, and you get this nice rotation. Okay, you can also just bring the elbow back and push with this inside arm, give you a nice thoracic rotation. Okay, now we're gonna go onto our knees. Now this is really important, and I do this one after the other ones because I want to loosen up my spine first. Okay, we're going to get into a hip flexor position, but instead of just holding, which is mildly effective, I'm going to reach down the side of my leg. I'm not going behind. I'm going down the side of my leg, and we're holding that position. My knee is traveling forward as I reach down to the ground. Traveling forward as I reach. This will open up the spine on one side and give your adductors, the inside muscles, and your hip flexors, the front muscles, nice stretch. They both can affect your spine. So we're doing this nice stretch, knee forward, arm down the side. After you've done about 10 or 15 of those, of course, you want to switch and do And a 15 on this side. Again, knee forward, down the side of my leg. You're opening up your hips, opening up your spine, and really getting a nice little jiggle. All the way down as far as you can, and 50% off, and back into it. Really stretch through those hips. Really, really feels good. Get that motion down. Okay, good. All right, and we're done. So I go through that morning routine. It feels so good. You've gotten your thoracic spine moving, rotation, you've gotten your hips opened up and stretched out, and you've really worked through not only just stretching, but pushing through with the muscles and through a stretch, an active stretch. And so it'll feel really good. The rest of the day, your posture will feel better. If you've had your peptides in the morning, you'll feel energized, you'll feel better, you'll have less inflammation in your muscles, and it will feel so good. Now, initially when you start, it may be a little bit sore. That's okay. As long as you're not getting pain down your legs, that would be an indication to stop. Or if you're getting severe pain after, whatever causes pain, stop, don't do it, but do the ones that you can do until your body allows it. This is my morning routine. It's saved my back. I feel wonderful. I move well. I play with my kids, and it's been a lifesaver. So hopefully it's helpful for you. Let me know if you have any questions.